Hey, good evening. How are you? Welcome to I Care for Your Brain with Dr. Sullivan. That's me. We have been meeting here every Wednesday for the last 3 years, and my goal is to give you the highest quality information that I can, combined with compassion and validation for all the brain health struggles that you go through, whether or not other people can see them or not. Since COVID-19 has hit and we are all more isolated and separated, I have felt even more of a desire to connect and provide you guys with a community that will hopefully fill in the gap in some of our real lives. I've been doing some more in-depth programming, offering webinars to the orthostatic tremor community, to the essential tremor community, and now I'm making my way all the way back to our awesome stroke folks. So I wanted to use our new comfort level with things like Zoom, where we could meet together over the internet in a way that's a little bit more in depth than we can offer through a Facebook Live. And I wanted to bring my book, the I Care for Your Brain Top 10 Rules of Rehab Interactive Stroke Recovery Guide, to life. I wanted to offer you all a new way of approaching a recovery group. Perhaps you've been invited to a support group in the past, and one of the reasons I wrote the book was that I found more and more people were not into that. It didn't appeal to them. The idea of kind of sitting around, the stereotype of kind of kumbaya and everybody sharing, and this image of people kind of crying, was not what I really found that people wanted. What I really found that people wanted was super, super high quality information about the most important concepts in brain recovery, like neuroplasticity. What exactly should I be doing every day that will actually give me the biggest chance at an optimal recovery? And that's really why we made the book. So now what I'm going to do tonight is talk to you about a 10-week program that we're going to be offering on Zoom that you all are invited to join us with. So tonight I want to explain to you how it's going to work, and you get to decide if you think perhaps it would be a good match for you. So starting on September 17th, we're going to go 10 weeks together, and each group is going to be an hour and a half long, which is so fun. If you guys have not participated in any of my webinars, it's actually really rewarding to get to go a lot more in depth with issues and to actually have interaction back and forth. So what we're going to do is each week we're going to go through one of the 10 rules of rehab, and each topic gets an hour and a half. I was actually halfway through offering this in-person recovery group in my community here in North Carolina when COVID hit us. We were actually at meeting number 5, and we had an absolutely amazing, enthusiastic, loving, supportive group of people that we were meeting with, and without warning, it kind of got torn away from us. So that's definitely been a point of grief for me throughout COVID, but we're hoping in my community to do some taping soon with the support of the First Health Foundation and get back into the homes of all the awesome people that had been joining us. But this is an opportunity to reach so many of you that are so much more displaced in the world besides right here in my little community in North Carolina. So across all international borders, this is something that's available to all of our learners. And really what's in my heart when I think of offering this program is that no one should not reach their maximum recovery after a stroke due to a lack of information. And so a few years ago, I went through every piece of literature that I could get my hands on stroke recovery and identified these top 10 rules of recovery. That what was in my mind is that even if people just had this guide when they got out of the hospital, that they would at least have a map of where to go. And that was because as a neuropsychologist, I just kept hearing more and more people say, I really felt very good about my care when I was in the hospital, but when I left the hospital, I felt extremely traumatized. I felt like I was kind of thrown to the wolves. I didn't feel like I had any support, and I had to wait till my next appointment to kind of be told what to do. And a lot of times that's when care can get fragmented, and you don't necessarily get the comprehensive physical support that you might need for a motor issue. You don't necessarily get the cognitive support for a word finding issue, and you don't really get the emotional support for the traumatic stress that very often goes along with having a stroke. So when I wrote this book, what I really wanted to do was to try to address all aspects of having a stroke. Way too often we focus exclusively on the physical, much to the detriment of the whole person. And so a lot of my writing in the book has to do with you have to process the emotional trauma that often accompanies a stroke. So these top 10 rules are things that leading neuroscientists in the world, they all know, and that's great for their academic ivory towers. But what I really care about is getting this information to the people that deserve it the most, which is stroke survivors and thrivers, which is you all. So once you understand these 10 rules, and certainly after you do an hour and a half on each rule, you really will understand them. You're not going to have to wonder if you are doing everything in your power to encourage your optimal recovery, because you're going to actually be in control because you have this information. So at the end of the day, what this is all about is that we dramatically need to improve post-stroke care. And once I see a problem in the brain health community, I feel very strongly compelled to offer a solution, because it's really not okay to continue with bad systems that aren't necessarily really helping people. So what we found is that people who are in these stroke centers, who are in the rehab communities, like I said, they are very, very happy with their care. But nationwide, what we know is that if you start to ask people and their families about how satisfied they are with care, once people return home, it goes way, way, way down. So nearly 80% of stroke survivors report one or more significant unmet need, especially in two areas. And that is exactly where I try to hit with the Stroke Recovery Guide: education and support. I cannot tell you how many people come to see me who know they've had a stroke. Maybe they know what side of the brain that it was on, but they really don't know where it was. That's kind of here. And then moreover, they really have never been told what that part of the brain does in its totality. So almost all parts of the brain really work in triplicate. And when you have a physical problem due to stroke, you're almost always going to have a cognitive or an emotional issue that kind of goes along with what that part of the brain does. That's just the way the brain works. But all too often we focus so much on the physical that people don't get validated for maybe the emotional or the cognitive symptom that they're having. And the problem is, if people don't know it's from their stroke, do you know what everyone does? We take it upon ourselves and we feel like, what's wrong with me that I'm not more patient? What else is going on with me that I don't want to be around people anymore? Well, guess what? You are overwhelmed because you've had a brain injury. And if you don't understand that that's just as much of a neurological symptom as it is that you have trouble with your left hand, then you're going to be left out in the cold, and you are probably going to develop things like post-stroke depression, post-stroke anxiety, but it's an unnecessary layer of disability that is causing you to have more trouble in life and have more difficulty being independent, and really it increases isolation, because then people feel very alone, and the loved ones in your life don't know how to support you because they don't really understand what's happening. So what would be amazing is if any of you are out there with a care partner who is able to really support you and maybe go along with the stroke recovery program. So the other reason we're doing this is that it is a cruel myth that brain healing only happens for a few short years after a stroke. We used to think that it was the first year that was a magic year, and however well you got within that year, that was kind of you in total. Then they upped it and they got generous and they said 2 years. Okay, after 2 years, then your window closes. Nope. Recovery is a lifelong process from a stroke. And what makes the difference is what you do, your behaviors. And so often people just don't know what to do. They go to their insurance-based rehab programs and they are given perhaps physical therapy. I've heard of people having to choose between occupational therapy and speech therapy because, goodness gracious, you should actually have it all. One of the big problems we have, I can only speak to the United States, is that we don't offer enough. There is a limit. You can only get so many sessions per year. Well, one of the things you're going to learn if you come to our recovery group is how much repetition you need. It is way, 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 way more than you are going to get in an insurance-based rehab. And that's just unacceptable to me, because if you know better, then you can do better. But if you go along with this myth that you're only entitled to but this much rehab and you can only get it but for this much time, you literally will not get as well as you deserve to get. So my thought is let you know what the science says and you figure out a way to implement it in your own life. So one of the big questions I've had is, well, where are people going to get this information from, right? Especially with the emotional side of stroke healing. And what really, really hit me like a ton of bricks about 3 years ago was that I have a responsibility to do better. If I know how things should be different, then I darn well better get busy writing a book, offering a group to get this information to the people. And that's really what's behind this whole I Care for Your Brain movement, is really a very strong feeling of responsibility that I have, that no one should not get as well as they can be because of a lack of information. It's just so important. So if we're going to start to think about more progressive, more humane ways to help people after a stroke, my first thought was that it really had to have 3 parts. And the first one is we really need evidence-based strategies for healing neurological and psychological. If we just go after brain, we're reducing ourselves to a 3-pound organ. That's not who we are. We are people. We are whole person, and we have to address stroke care accordingly. The other thing is we have to offer people personalized support and track their progress, keep them motivated, keep them positive. Mindset is a huge part of stroke recovery, and man, is it so easy to go negative, to feel like, why bother? If you're not attuned to picking up on baby steps and micro rewards and tiny, tiny little bits of progress, it's very easy to not feel reinforced. So we're really big on tracking things. We have a lot of write-in things in the stroke guide where people can actually get a really personalized sense of where they're going. The other thing is I had to include empowerment tools, because in this day and age, in this type of healthcare system we have, if you don't know how to advocate for yourself or a loved one, get out of here. You're definitely not going to get well. But the challenge was, how do I offer something that kind of fits all people, with the reality that every brain is different, every stroke is different, every stroke recovery is going to be different. So the whole idea here is no matter what you're struggling with, your arm, balance, visual neglect, cognitive, emotional, petrified you're going to have another stroke, once people learn these 10 rules, you basically apply them to any problem that you're having. And that's as much information as I know after studying this stuff for years and years and years. So again, like I said, you don't know what you don't know, and that's when you basically stay ignorant. So a big part of what the stroke recovery group is going to be is really helping you understand neuroplasticity. So all that this means is that the brain has the extraordinary power to reorganize and grow new connections after damage. You can help your brain physiologically recover after a stroke by making new connections. You can also compensate for the things that you can no longer do by doing them a different way. And the final adaptation is acceptance. There is a huge place for acceptance in post-stroke care. But what we have to help everyone understand is acceptance is not giving up. Acceptance is not, I'm turning my back on this symptom and I'm never going to look at it again. Acceptance is leaning into it and living your best life despite the fact that you may now have a limitation in that specific area. So when we start talking about rewiring and rebuilding brain networks, what we're really talking about here is what are the experiences that you can do for your brain that will really promote this fertile soil to help these new tendrils grow all around your brain and make new connections. You can never forget that a stroke is a focal injury. Your whole brain was not injured. A stroke is one or a few other parts of your brain. Mostly for most of you, it's one part of the brain. You've got the whole rest of your healthy brain to learn how to compensate. And that's really what we try to focus on, is what do you need to do to get those other parts of the brain to kick in? And really, it's as simple as this. We have to put you in what we call an enriched environment. An enriched environment is what are the things that you can be surrounded by in order to promote your brain into a state of neuroplasticity. And it's really a combination of two things. It's a combination of complex stimulation with very specific schedules, and it is periods of high quality rest, including REM and non-REM sleep. If you can perfect the balance between these two things by knowing exactly what to do, guess what? You are going to be in a much stronger position to pull the best recovery out of yourself. So how did this idea of doing a group from the book come about? Well, what I realized is that Not everyone necessarily interfaces with a book in the best way. If you have a reading issue, if you have an attention issue, that's not necessarily the most accessible way that I can get to you. And what we do when we bring a group together is we bring community together. And that's what's going to be so cool about the stroke recovery group is I'm really hoping to get the same people at each of the 10 different sessions so we can actually start to build a community that is sharing and is supportive of each individual person's struggle. And that is so, so, so exciting. So this stroke recovery group is designed to empower you with knowledge, and it is meant to be interactive, okay? But what the group isn't is it's not going to be a traditional support group. It's not unstructured. How it's going to work is I am going to have about an hour's worth of a PowerPoint presentation where I explain the scientific background of the rule. I'm going to explain to you how you're going to put it into practice in your everyday life. So it's very information based. It's not personal medical care. I cannot tell you specifically, based on your MRI that I look at, here's what you can do. These are universal rules that you can make personalized for yourself. All the decisions that you have to make about your brain health care need to happen between you and your personal doctor, right? So this group is for someone who had a stroke yesterday or someone who had a stroke 60 years ago. If you've had a big stroke, if you've had a series of little strokes, if you've had a transient ischemic attack and you are wanting to know what do I need to do to build my brain up so I'm as least susceptible as possible to having any damage from a future stroke, I think this group is for you. We certainly welcome caregivers, rehab professionals. There are a lot of folks who work in the stroke community that don't necessarily have the training to provide the optimal information and support. And really that's because we don't do a very good job of hooking stroke survivors up with therapists and psychologists. So you know who becomes the therapist? The physical therapist, the occupational therapist, the nursing assistant. And oftentimes those people have the best hearts. They just don't know what they don't know. And so we're really excited to welcome everybody into the group. So we're going to get started on September 17th. And like I said, each week for about an hour and a half, we are going to go through each of the rules of rehab. So what is the first rule? The first rule is making your map. And that's where I tell you, who are all the professionals you need to have on your care team? What does each one of them do? How do you, look at all these hearts. Y'all are loving me tonight. That is so awesome. And then we go through rule 2, build on what's familiar. That is how I teach you how to personalize your stroke recovery. What works for me and my brain and the way my brain is oriented is not necessarily what's going to work for you. So we have to talk about how can you take any rehab exercise and make it personal for you. Rule number 3 is repetition and consistency. You will be blown away by how many repetitions you need to do of a rehab exercise to make it effective. What they offer you in an insurance-based therapy program, not nearly enough. So if you just do that and you think that that should give you certain results, it's not. You have to understand, what does the science tell us that we need to do? Rule number 4 is to harness your creative power. So much of our brain is creative, and rehab, for the most part, unfortunately, is relatively cookie cutter. I know that there's a ton of awesome, amazing creative therapists out there, but too often they're not working from a uniform curriculum. They're bringing their own heart into it. But I want you, as the person who's living with a stroke, to understand how creativity enhances neuroplasticity. Rule number 5 is we're going to talk for an hour and a half about sleep and the incredible power of sleep when you're recovering from a stroke. Not too much, not too little. There's a couple sweet spots. You need to understand the role of rest, quality rest in your recovery. It's definitely under prioritized. Rule number 6 is increase your emotional resilience. How many of you feel like you were hit by a ton of bricks by this stroke in terms of how you feel about yourself and your confidence? We have to talk about how to feel empowered, strong again in your body after a stroke. Rule number 7 is supporting those who support you. I can see on here, Mrs. Celinda, that you told me you were a caregiver. Well, I need to help your loved one understand why it's so important to make sure you're okay and that you get the acknowledgement and gratitude that you need. Because guess what? It backfloats to them in terms of their recovery. Caregivers who are stressed out have care partners who don't get as well, and we can't ignore the unbelievable sacrifice and commitment that caregivers give. That's worthy of a whole hour and a half. Rule number 8 is to acknowledge your trauma. I have met very few people who've had a stroke that when you really ask them and you get them comfortable enough to talk about what they've been through, it's a trauma. You can absolutely have post-traumatic stress disorder from your stroke. They used to think it was assault-based. Someone had to do something to you, a physical assault, war. Then about 10 years ago in the literature, they started to say a cancer diagnosis could traumatize you. But again, it was still something from the outside happened to you. But now we absolutely know a stroke, something internal, 100% meets the definition of a trauma. And if we don't acknowledge your trauma and give you the tools to work through your trauma, guess what? Your anxiety on top of your stroke symptoms is going to make your disability worse and make your quality of life worse. Rule number 9 is how to insist on follow-up care. I can't tell you how much it pains me to have people come to see me in my clinic who haven't ever seen a neuropsychologist and they're 5 years out. People who go to the neurologist and the neurologist says, well, I think I've done about all I can. I'll see you in a year. What in the living, breathing are people supposed to do in that year? That kills me to think that people are basically turned out and not given a map or a rule guide about what to do. And rule number 10 is that transformational power of acceptance. If we don't talk about how to make room in your life for what this stroke has done to you, and we only talk about full recovery, I'm not doing you a service, because if your stroke was big enough, it was significant enough, you probably will be living with some residual symptoms for a pretty long time, if not forever. Doesn't mean they can't dramatically improve, doesn't mean you can't compensate around them, but if I don't help you with acceptance, I'm not going to be doing enough for you. So how will participating in the stroke recovery group help you? I really feel like you will feel empowered because this is new information and information is power, right? Knowledge is power. I really feel that you will feel stronger because you'll feel prepared and informed. I really think it will help your anxiety go down because you'll actually have tools. It won't feel like I'm lost, I don't know what to do. The validation that people have told me that they felt from the book and the group is huge. Having the tools to process your big feelings and memories of scary things that have happened to you. Feeling motivated to participate fully in rehab is a very important thing. If you don't understand the why of why you have to do something over and over and over and over and over and over again, it's human nature that you're gonna give up on it after a while. I know that you will be less vulnerable to too good to be true claims from, brain health products and recovery tools that don't really work. I try really hard to debunk money-wasting things that aren't gonna really get you anywhere. And maybe what I care about most is that I think you will feel more confident. That is one thing that people don't validate enough, is how stroke really knocks your confidence down. And what I care about is boosting you back up. And I think that we do it best with education and empowerment. So what do you all think of this? I'm so excited. So here's what you can do. You can go on our website, www.icfyb.com, icareforyourbrain.com, /SRG, S for stroke, R for recovery, and G for group. And how it's gonna work is you can sign up for one lecture, you can sign up for all 10 lectures. It is $10 per lecture, and the way I want you to think about that is it's cheaper than a copay when you go to see your doctor, and you're gonna get a whole heck of a lot more information. It's an hour and a half of super in-depth information and support. If you are listening and $10 would be a hardship for you, I want you to reach out to us and we will find a way to help you regardless, okay? Everything that we do in I Care for Your Brain, we always take a portion of the money that we get from people and we put it back into the community. I know that you are used to getting my programming from me free here on Facebook, and I love that. But when we go deeper and it takes more time, there's just simply overhead that we need to take care of. So I hope that that feels like a fair price to you all. I hope it feels like you would get your money's worth. And I can tell you with all things that we do here at I Care for Your Brain, we put 100% of our mind and our heart into it. We are so privileged to be with you all. Honestly, we feel so lucky to have this immediate connection with all of you through Facebook. It's been an incredible gift. But we also know that sometimes we have more to offer you than we can necessarily give in the 25 or 30 minutes here. So please go on to the I Care for Your Brain website at /SRG and sign up and let us know that you're going to be there with us, because we are super, super excited. The way Zoom works is it's limited in terms of people that we can have on there. So if you are interested in being with us, please go ahead and sign up for as many of those that seem important to you. Like I said, you can definitely pick and choose. If you want to get the full program experience, you can sign up for all 10. It will truly be my pleasure to see you there. I cannot thank you enough for being here with me, and I'm going to give Jerry Wald a shout out, because I was on Jerry's show recently and I told him about this idea and he really encouraged me. And that was I told him that day, I was like, Jer, that's it. I'm doing it. You convinced me. So I am so grateful to you, Jerry, for all your ongoing support in the stroke community and also of me as a neuropsychologist. Thank you so much. So I hope you all have a great rest of your day. I so look forward to seeing you guys in September, and I hope to see as many of you there as I can. Take care, you guys. Have a good night. Bye.